Bill Hammett. This is our open enrollment presentation for employee benefits that start December 1st. Here's my information on the screen. Happy to help you through this process. Also available throughout the year to you guys is Anna and Araceli. They can help you with finding doctors, looking up prescription drugs, having claims that didn't go your way, getting new ID cards, whatever it may be. We're here throughout the year for you to support you and get you through this. Quick agenda, we'll do the timeline, medical, dental, vision, how we enroll, and then questions, like I said, jump in the middle of this if you got them, or at the end, I'll stick around for as long as there is questions. So open enrollment starts today. You will all be receiving an email inviting you to log in and enroll. We're asking everybody to be done with this in 1 week. So next Monday, the 24th, this is the time you have to do anything you want. Enroll, remove plans, add dependents, switch plans from whatever you had before, whatever it may be that you want. This is your free time to do so before you're locked in for the year. Any changes you do make go into effect on December 1st. So even if you log in today and add dental or remove dental or whatever it may be, that doesn't change until actually on December 1st. And then we're asking everybody to get this done by Monday, November 24th. Sorry. We got really not much in the way of changes, really, honestly. We got HealthNet, we got Kaiser, we got Anthem, we got all the same plans. We've got the 6 plans from HealthNet. We got Saluti Moss, which means I want to go to Scripps Doctors. We've got Smart Care, which means I want to go to Sharp. There are more providers than just those 2 sets of providers, of course. But as you know from this town, this is a big, major two system town. So a lot of us are like Scripps, think Saluti Moss. If you like Sharp, think Smart Care. So here's our silver plan. So these are both very similar plans. I put in bold here the Salud network. So if you're using this HMO plan with Scripps on the state side, on the San Diego side of the border, you're in the Salud network. But this plan also actually gives you coverage in Mexico through the SIMSA network. Don't think many of you are really accessing that or interested in that, but it is available. That's why it kind of shows both of these networks alongside each other. If you're using this at Scripps, you're looking at the bold print as your benefits. And you'll notice that in the bold, it's exactly the same benefits as you see on the Smart Care plan. So there's really no difference between these 2 silver plans based on benefits. The difference is the network. All right, so who you're going to see. These are really, really strong silver plans, frankly. Every other silver plan in the market has a $2,000 to $2,500 deductible. And in this case, you have a 0 deductible. So you're never out of pocket 100% for anything, which is killer. Your maximum risk is $9,200. So what does this mean? Max risk is the most you would ever pay in a calendar year, no matter what happens. Okay. If you have a $100,000 claim or $1 million in claims, the most you're going to spend in a calendar year is $9,200. Now, notice I've said the words calendar year multiple times. This is January 1 to December 31. All right. Our plan year is December 1st, right? So if you're joining this plan for the first time and you have multiple expenses, it is going to start over from 0 on January 1st. So obviously, if you need to access your benefits and you have a hospital stay, emergency room, whatever, go use it. But what I want you to be considering is if you're considering elbow surgery, knee surgery, you got whatever's going on, maybe a big ticket item that is relatively flexible on when you schedule it for January. Don't schedule for December, because whatever dollars you spend are not going to be going towards your 2026 maximum out of pocket. All right. So dollars going towards that. What do I mean by that? Everything you spend, this $55 for a regular doctor visit is going towards your $9,200. $90 for a specialist going towards your $9,200. X-rays, labs, MRIs, physical therapy, prescription drug benefits, hospital, all of these dollars are accumulating on a rolling basis to $9,200. And whether you get there $100 at a time or one big major surgery or something, you stop at the $9,200. With the silver plan, couple of things to point out. Really good, no deductible, co-pays across the board. Hospital stay has a $750 copay per day. That's fantastic. Some of the drawbacks: your prescription drugs, your brand name prescription drugs, 50% up to 250. What this means is if you're on one of these tier 2 or tier 3 or even a tier 4, that's a self-injectable, that's those cancer drugs. Um, you pay the 100% of the cost for the first $500, and then you're going to pay 50% of the cost of that drug up to 250 max. All right. So that first prescription drug, if you're on something that's crazy, maybe say it's a $1,500, $1,800 a month prescription drug, you're going to pay the whole $500 brand name drug deductible, and then you pay 50% up to 250. So you could have initially a $750 prescription drug. But just know once you meet that deductible, you've met it in full for the year, calendar year, and then you pay 50% not to exceed 250. All right. So, couple things, calendar year there again. If you are on one of these drugs, maybe you want to wait till January 2nd to renew it rather than December 30th, if you can. So, this plan here, really good for day-to-day stuff, really good even for a hospital stay, but prescription drugs, brand name prescription drugs, there's a drawback there. It's going to be more expensive. Surgery more expensive, and emergency room 50% of the cost. So this is a really good plan for those of you that aren't using a ton of insurance. Once we get to our gold plans, you'll notice still zero deductible, lower out-of-pocket max, lower copays across the board. The prescription drug benefit is 10 times better, no deductible, flat copays. Surgery and emergency room, now you have flat copays again. So I want you to think about these gold and silver plans as if you're into a silver plan, it's because you really don't expect to have any of the big ticket items. If you feel like you might have a surgery, you have been in the emergency room a couple times a year, you got brand name prescription drugs, I want you to be thinking more gold. That might maybe suit you a little bit better. And while it does cost you more per paycheck, remember that per paycheck cost is tax-free because it's coming out of your paycheck before you pay taxes. And all of these dollars you see here are coming out with after-tax money. All right. So it is worthwhile if you know you're going to have the expenses to spend more tax-free money so that you buy down your after-tax out-of-pocket expense. Any questions on those, all that we just talked about right there? All right. Again, there's going to be time for questions at the end. Again, we kind of talked about this already, medical groups in the Salute Network versus the Smart Care Network. That's what you can see. Take a look there. You should be already pretty familiar with which one of these two plans you're in. If you're enrolling for the first time and you need some more help with doctor visits, let me know. Doctor choice, let me know. I'm happy to help. We also have a couple of PPO plans available. I don't think we have any enrollment in that right now, but PPO plans give you greater flexibility. You're not stuck with any medical group. You can go to Sharp for a regular doctor. You can go to Scripps for a surgery and then see somebody at UCSD for something else. PPO offers you great flexibility, great freedom of movement, a better healthcare experience, but it costs a lot more. So that's the drawback. It costs more, but you get more. So somebody that might choose a PPO plan is doing so because they value that freedom of movement. They've got very specific needs healthcare wise, and they're going to spend more money out of their paycheck so they can really take advantage of going to a lot of different providers. If you're happy staying within a medical group to get all of your care, I think a PPO plan might just be a waste of premium dollar for you. Health Net's got a cool teledoc system as well. So this is 24/7 on demand talking to a doctor. Lots of different great options here for non-emergency conditions. Really good stuff here. Kind of healthcare coming into the new world where we can access providers in a through a telephonic way or even over the internet. So really good stuff there. It's www.teledoc.com. There's the phone number here at the bottom. And there's more information embedded into the Ease portal for you. In addition to this, they have the My Strength benefit. This is also something that you can sign up online. It's mystrength.com/hnwell. You can download the My Strength app. Lots of different really cool tools for you to take care of your health here. So something fun to do, something added value. If you're paying all this money for insurance, make sure you're taking care of all the things that you can, all the benefits that they give you. We got a couple of Kaiser plans. We've got some interest in Kaiser. So there's two options. There's the silver and the gold. Same thing as we talked about with HealthNet. Silver is going to be the lower cost plans, but more out of your pocket when you go to use it. Your Kaiser Gold plans are going to be more out of your paycheck, but less out of your pocket when you go to use it. Specifically, check out your deductible 1900 versus zero. Co-pays are going to be a little bit higher here on these silver plans. Notice if you need MRIs on a silver plan, you're going to pay your entire $1,900 deductible before you get your copay of $400. Prescription drugs, they're combining the deductible for the tier 4 only. So if you're on the self-injectable cancer drugs, you got to meet your deductible first. But for tier 1, tier 2, you're going to have a flat copay. The biggest difference for me is when you look at hospital service, you look at surgery, and you look at emergency room. On these silver plans, if you have any of those, you're going to be blowing through your deductible and hitting your out-of-pocket maximum pretty quickly. With a Kaiser Gold plan, all of it is a flat dollar copay. So just to give you an example of what does this mean, 45%? So let's say I'm on this plan here and I have a $100,000 problem. I will pay 100% of the cost for the first $1,900. Then I'll pay 45% of the cost. Kaiser pays 55% of the cost. This is co-insurance. They pay some, you pay some, until my deductible plus my 45% equals $8,750. Again, this includes your deductible, $8,750, at which point I pay zero. Kaiser pays 100% for the rest of the calendar year. Okay, so again, $8,750 maximum out of pocket. Any questions on the Kaiser plans? Okay. So reminder, Kaiser's got an app too. The number one thing you can do to improve your healthcare experience is download these apps to your phone. You can talk to doctors, you can order prescriptions, you can set appointments, you can look at claims. All of the things that you want to do are in the palm of your hand. We use these apps for literally everything else. So let's also make sure we're using it for our medical plans. A little bit more information on Kaiser, different ways you can get care, obviously by phone, video, email, a lot of ways you can get care. We got one dental plan from Anthem Blue Cross. It has a $2,000 maximum benefit. Remember how we talked about medical maximums are you pay nothing, the insurance company pays everything else. Well, with dental PPO plans, it's the exact opposite. With dental PPO, once the insurance company has spent out of their pocket $2,000, they pay nothing else and you pay 100%. All right. So very important for two reasons on this. Number one, this is calendar year. Here we are again, calendar year. And what you need to know is if you are currently enrolled in this PPO plan and you haven't really used your plan, you've been putting something off, you need to really consider doing that before the end of the year so you get that done and taken care of, and that benefit comes off of your 2025 maximum so that you start 2026 with the full $2,000 and you can spend more there, right? Because you've already gotten some done. They don't roll these funds over from year to year. So if you don't use it, you do lose it. So if you've been putting something off and you haven't really used all of your benefit, make sure that you do some of that before the year's over so you've got more money to play with next year. The other thing I'll say is if you're not enrolled in dental at all and enroll in this plan December 1st, you have $2,000 to spend in the month of December. And then January 1, that's a new calendar year, you get the other $2,000. So you could theoretically get $2,000 worth of work done in December. And then January 1st, have another $2,000 to spend, use that $2,000. And next year, when we're sitting here, you decline dental, you got $4,000 worth of benefits to the price of 12 months. So a little way to kind of stick it to the man there a little bit. So, that's what you need to know about dental. Also, everything with dental is really in three different sections. Preventative, they cover 100% of it. This is your twice yearly exam. This is your cleaning. This is the x-rays. And then basic, these are going to be things like cavities, periodontal coverage, periodontal, endodontics, things like that. And then major is going to be crowns and surgeries and those kind of things. So that's what all of these different percentages fall into. If you go out of network, it still pays this percentage, but it's paying a percentage of what's usual and customary. So You don't necessarily want to go out of network if you can avoid it. If you go to out of network dentist, that means they have not agreed to a contractual dollar amount to charge you. In-network dentists have a whole list of contractual obligated discounted rates for everything, and that's all that you pay. When you go out of network, they can charge literally whatever they want. All right. So with a 90% of UNC, that's 90% of what's usual and customary is what would be reimbursed for your out-of-network dental services. So try to stay in network if you can. Anthem's got a very large network, but I know sometimes we get very attached to our dentists, and that's completely fair. If you do need to use out-of-network dental benefits, they are good in terms of what out-of-network benefits are, but I would not call them great benefits. Out-of-network never is. Any questions on dental? All right. Dental PPO, very easy to find. People, they have the app as well. So find a dentist at anthem.com/CA. If you need help finding dentists, happy to help. Our vision plan also through Anthem. We've got a pretty good one. You've got a $10 copay for eye exams once every calendar year. You've got a $25 copay for new lenses once every calendar year, and a $200 allowance for frames once every calendar year. So this is a good plan. Once every calendar year for each of them. Sometimes these vision plans make you wait every 2 years for some of these benefits. Again, finding a provider, same place, anthem.com/CA. So next step, you'll be receiving an email from us inviting you to log into the ease portal. Make your elections by Monday, the 24th, if possible. If you've got any extenuating circumstances that make this difficult, please let us know. If you need help enrolling anything, please let me know. Happy to help. This is the email that you'll be getting. You might have already received it. You'll click on this little sign up button down here to get started. You'll land at biasd.ease.com. Username, password. If you forgot that, just hit the forgot button right there. And if you got any questions, need any answers, I'm here for you. I'll stay on the call as long as you have questions, but I'll leave it on this last slide here so you've got my information. If you want to email me and set up a time one-on-one to talk about anything, happy to do so. So that's the end of my presentation.